So how do you take a bite for the DreamOne Pro? So basically the DreamOne Pro or the Mini, they are mandibular advancement devices. So you need to take an advanced bite or a protruded bite. So how do you do that? You do that with specialized bite forks, and I'm going to tell you why. Now the DreamOne Pro, as you know, has an integrated airway channel. So it requires, you need 5 millimeters of vertical clearance in order to fabricate the device, because you need 1 millimeters of thickness for the trays and 3 millimeters for the integrated airway, which is a USP of the device. So you have a specialized bite fork which you can very easily use to take a bite. So now these are single-use bite forks, and what I'm showing here is a multi-pack, and there are 4 types of bite forks. You have 2 sizes, medium and large, and 2 variants. You have single-sided and double-sided. This is a double-sided bite fork that is 2 slots, and then you have a single-sided bite fork that's only 1 slot. In normal cases, when patient has a class 1 bite, you can go for a double-sided bite fork, which brings the jaw to an edge-to-edge position, which may be sufficient in majority of cases. Okay, so always when you use these bite forks, you can recline the chair a little bit, and the patient can bite onto this, and you can even speak to the patient as to how you're feeling while using the bite fork. So they themselves can get a feel of how the device will be. So you have these, and if required, you can trim excess from the distal part if it's too much, right? So that's where you'll use a double-sided bite fork. Now, when will you use a single-sided bite fork? In some cases, maybe the protrusion is not enough. You need, this edge-to-edge doesn't work because the initial position may be close to your edge-to-edge position. Sometimes you need a little more of protrusion, or sometimes the edge-to-edge position is a little too much for the patient and you need to take the jaw a little back. So in such cases, when you want to do a custom position is when you will use a single-sided bite fork. So for a single-sided bite fork, there's only 1 slot. So now how are you going to custom position the jaws? That's when you're going to use a protrusion gauge. So you can either use, we have a DreamOne 3D printed protrusion gauge, which you can use, or you can even use the George gauge, okay, from Great Lakes, and any type of gauge that's going to support this bite fork. So now, for example, if you're going to use this George gauge, you're going to unscrew the upper set screw and place it in line and screw it back in, right? And then your readings are going to be, it's going to be right at the center. It's going to show 0. So that this is how it's going to look. So you have 2 slots, right? So, or you can also use the printed protrusion gauge. Now this is a 3D printed biocompatible protrusion gauge, and you also get the instructions for use as to how to go about recording the bite with the gauge. So again, this is 3D printed, so you've got to be a little careful with this, right? So unscrew the upper screw, and voila, you have the upper and lower slots in place. So, and the gauge is going to be at 0. So it's simple how to use it. You unscrew this, get the patient to go as back as possible comfortably, ask the patient to protrude as comfortably as possible, to the maximum levels, and then you measure the difference. You get the range of movement, and you calculate 60% from that range to give a starting point for the protrusion. Definitely, it's we've got other videos to demonstrate as to how to record the bite using these protrusion gauges, so you can see that video for more information. But yeah, so that's how we have these 2 types of bite forks. We have the single-sided bite forks, and we have this double-sided bite forks. And so for majority of cases, your double-sided bite forks will work, and in other cases, you can use this protrusion gauge and use the single-sided bite fork. So you can't use the single-sided bite fork in itself. You will have to use it along with the protrusion gauge. So the good thing about this is you get the exact space that you need for the device. Okay, so you can 3D print, you can 3D scan. You can use an intraoral scanner and scan this bite with this fork in your mouth or in the patient's mouth, and or you can do a conventional bite registration also. So there are many ways to go about it. But it's really simple if you do it digitally, because you just, if you're going to use a double-sided, ask the patient to bite edge to edge, take upper and lower scans, and just take the bite scan in this position. A good thing about this fork is, you can ask the patient, or you can let the patient know, or give them a feeler as to how it's going to be with the final final device in their mouth. When you close into this, you get the opening is there. You get the 5 mils of opening, and the protrusion is also there. So the patient fairly gets an idea as to how they're going to feel with the device. So you can recline the dental chair a little bit, and ask them to try to snore, and definitely this brings the jaw forward, so you can see how much of protrusion is they can tolerate, and you can get the right bite for the DreamWand Pro.